So, Dr. Matt Young, thank you so much for being here on the podcast. You have no idea how excited I am to talk to you. It's been a long time, and I'm happy to see you.
Good to see you too, Jessica. I remember when you came to the Burn Center.
I had a lot of fun, and I have to tell you, I've taken a lot of learning points from my time spent there. There's a lot of things that I am scared to do with my kids ever since spending time in the burn unit.
That's funny.
So yeah, thank you. A lot of those stories definitely stayed with me. So tell everybody about yourself. Tell us who you are and what you do for work.
I'm trained as a pediatrician. I went to medical school in Texas, in Houston, at the University of Texas. Did an internship in North Carolina, and I did a residency at Children's Hospital of Los Angeles, and then I was at Cedars-Sinai with your dad and was chief resident there. And while I was there, I was hired by a pediatrician in Encino, Neil Minkoff, to cover the burn center. The burn center started as the Sherman Oaks Burn Center in 1969. So he was the same age as the founder of the burn center, Minkoff was, and he had covered pediatrics at the burn center and wanted somebody to help share the time doing it. And so when I was still a resident in 1978, I started working at the burn center, and then I started with his pediatric practice in Encino, and was a regular pediatrician, just general pediatrician for 13 years, but also did the burn center. And then he died in 1985. He was only 52. He had stomach cancer and just died within a month of the diagnosis. And so I took over doing the burn center all the time. Then it got so busy, and I was assisting in surgery and we had a lot more burn kids actually then than we do today. And we would admit like 100 kids a year to the hospital. So I left my pediatric practice after 13 years and did full-time burn center, which I've done ever since.
That's amazing, and it's such an interesting niche.
Yeah, it's unusual. It's just one of those things that was very fortunate for me to fall into. It was my fate.
It was your fate. And I love what you said about how there's been fewer pediatric admissions since you started working. I'm so curious, why do you think that is?
I think parents are probably more conscientious. We see a lot of burns from children who are in poverty, where they cook on the stove and they have to take the pot off and put it on the floor to let it cool off while they cook something else on their little stove. Things like that. Somehow we don't see as many. I think people are more conscientious. Probably there's the change of the temperature of the hot water heaters probably makes a big difference. We used to see, kids bite into electrical cords and see a lot of mouth burns. We don't see that as much anymore. There are a lot of kinds of burns that we don't see as much of or seldom. But the common ones are basically in the young children around the age of 1 is the hot liquid burn from either coffee or tea. Probably the most common is like cup of noodle soup out of the microwave, and they set it on the counter and the kid grabs it and pulls it off onto himself. That's probably the most common burn we see.
So can I tell you that exact story about the cup of noodle soup? When I mentioned that the cases that I saw with you, how I still think about them today, that's the number one thing that I think about, is we had seen about 3 top ramen or cup of noodle burns in a span of a couple of weeks, because I think a couple of the kids took soup out of the microwave, put it in between their legs, and the flimsiness of the styrofoam it was so easy for the liquid to spill over into their thighs, and they caused quite a bad burn.
Yeah.
So after that, I don't think I've ever bought my kids a cup of noodle soup because of my time in the burn unit.
That's true.
So I find that very interesting and refreshing that while there still are burns that exist, it's nice to know that some public health measures and interventions have made a difference.
I think so. I would say the thing we don't see as much is child abuse, which we used to see more. And I think that kind of ebbs and flows, but it's not as common right now as it was in the past, I think.
That is amazing news to hear.
But those are horrible cases where it's child abuse by burning. I mean, I'm sure there's a lot of child abuse, but not as common to see it by burning anymore, I think. That's good.
Yes, I can definitely agree with that. That is very good. So I'd love to ask you more about prevention of burns, because of course there are treatments we can do for burns that we'll talk about in a bit, but I'd love to spread more awareness about typical burns and how they might arise so that parents can know how to prevent them from happening in the first place. So what are some common household hazards that you see that may cause burns in children? I know that you had mentioned pots and pans. Is there anything that you wish parents knew to help make their homes safer?
I think probably the most important one is to keep your child as much as possible out of the kitchen when you're cooking. I mean, the kitchen's really the most dangerous room. And we not only see hot liquid burns from water or soup, but also from oil, which is much hotter than water, and so it causes a much deeper burn. Just oil splashing out of a pot, or the other thing that I think I've seen more often is contact burns from children touching an oven door. Pretty bad. They can get bad burns to the hands from the oven. They also get bad burns from the hand from these fireplace doors, the glass fireplace door where the child will pull his hand against the door and they can get bad burns from that.
I had a patient once get a burn from touching a fireplace door at a restaurant, actually. That got pretty severe.
Yeah. Yeah, it can be bad. Hand burns in a child are tricky because they can end up being permanently dysfunction of the hand, where it just scars down and not functional. It's a terrible tragedy.
Terrible. I've heard tips that if you are to cook with your kids in the kitchen, to make sure you use the back burner of the stove and to turn the handle of the stove away from the child so that they can't reach up and as easily pull it down.
Definitely. That's a good idea. Yeah, to use the back burners.
Yes, and you're right about oil. That's something also that I learned more from spending time with you, is that oil can penetrate the skin more and cause a deeper burn. So for sure,
Right.
keep your kids away when you're using oil that may potentially splatter.
Right. And the other thing that happens with oil is sometimes it catches fire, and people try to carry the pan on fire outside or somewhere. And the thing that, when you have a pan that's on fire, you cover it up, you put the top on it, or you put a blanket over it, something just to cut the oxygen off. You don't try to take it anywhere. That's where you get bad burns, is where you're trying to carry this flaming pan out the door and it falls onto your child.
Do you recommend keeping a blanket by the kitchen, something to
Probably
cover
a
up?
good idea. Probably a good
I
idea.
think I saw an ad for something like that on Instagram and I brushed it off, but maybe I should pay attention the next time.
I don't know. Maybe any blanket would work. I don't know. Or a towel. I'm not sure. I think putting the top on is probably the best if you've got a top.
Yes. And I like the reminder about coffee causing potential burns, because it's true. I picture parents that are tired with newborns and they're holding their baby in one arm and their cup of coffee in the other hand, and they're just so tired, and the baby may move their arms and knock the coffee cup. So easy to get a scald burn with coffee in a young child.
Yeah, and people don't realize how hot that coffee can be, especially if it's just recently heated or it's come out of the microwave. It can be 180 degrees, which can cause a third-degree burn.
Wow. And will you briefly explain the difference between a first, second, and third-degree burn?
Yes. So you basically have two layers of skin. You have the epidermis, which is the top layer, and then underneath that is the dermis. So a first-degree burn is just redness, like a sunburn, where the epidermis gets red, but the skin doesn't blister, and it's basically just treated with moisturizer, and it'll get well, within a few days. Second-degree burn is a blister. So that blister is your epidermis. So you basically lose the epidermis, or it's either forms a blister or it just comes off. And so you're left with exposed dermis. Exposed dermis, if it's healthy, can make new epidermis. But if it's burned all the way through the dermis, then the only way that can heal is by scarring in from the edges. So a second-degree burn is a blister with healthy dermis. Third-degree burn is the epidermis is gone and the dermis is dead. So that's what usually needs a skin graft.
It's so interesting to think of burns in that capacity.
Yeah, they can, that's the other problem with children. Of course, they have much thinner skin than adults do. So the same temperature of contact with hot water or coffee or whatever will cause a deeper burn in a child than it does in an adult.
Oh, that's an interesting point. Do you see as many electrical burns? I know you had mentioned that kids aren't chewing on wires as much, but I feel like the outlets now are much more updated in many of the homes, where it's not as easy to put your finger in a socket and get a burn. Do you feel like you've seen fewer electrical burns?
Yeah, definitely. The cords are thicker and the outlets are more protected, so it's harder. I mean, you don't see children who stick something in an electrical outlet very often, and usually even then it's a minor kind of burn. It causes a flash and the outlet shorts out. So I think that's helped.
What would you say are the most common electrical burns that you still see today?
Well, in children, don't see it that often. I would say it's usually just trying to think if it would be a spark. In the old days, it wasn't that they bit through the cord so much as they would take the end of an extension cord and put it in their mouth, the terminal. And that would cause really disfiguring burns around the mouth, and there wasn't good treatment for it. Surgery still left a scar. You'll still see people who've had an electrical burn as a child with scars on around their lips. But it's pretty rare.
You may not know about this, but I use a hair dryer, and there's always this warning on the label of the hair dryer that be careful if it falls into water, it may cause electrical burns. Is this something that you see often? Because it makes me nervous when I see that sign and my kids around me.
I don't see that. I don't know if it causes a specific burn. I think it can cause some type of electrocution if it's in water, but I don't think it's a real specific burn. What we see with hair dryers curling irons, are where the child grabs the hot end of the curling iron, and that's really bad. I've seen a child actually where the pediatrician told the child had colic, and the pediatrician told him to put a hair dryer in the crib with them to kind of calm them down, and they got a bad burn to their hand from that.
Wow, you're right, because that is advice that I've heard pediatricians give. The sound of the hair dryer provides that white noise machine sound, and that's a good thing to keep in mind. Thank you. Yeah, I really feel like talking about this is helpful, because just knowing what our potential causes of burns, I think, will hopefully help somebody out there avoid a burn in the future. So these are great tips.
Yeah.
Another question I want to ask you about, something that I remember from working with you, is we saw quite a number of treadmill burns, and that's something that we now have a treadmill in our garage, and I'm so careful with my kids around the treadmill because I'm afraid that they may get a burn. Can you explain to people about that? Explain how a treadmill could cause a burn in a child.
Okay, this would be a friction burn. So the child, it's just like a sander. Basically, they put their hand or their fingers in a sander, and it just sands off the skin from the treadmill. Usually, they stick it underneath the treadmill, and they can get a third-degree burn, usually to the hands. I've seen some kids who fell down on a treadmill and got friction burns on their face, but it can be, again, catastrophic, because the hand is so critical as far as function goes that often those kids need to have surgery and get skin grafts.
I believe the child that I saw with you did need surgery and skin grafts.
Right. Yeah, probably so. Yeah, we still see that quite a bit.
I think in this case, it was a baby that was crawling. The parents didn't see the baby, and they came right behind the treadmill, got their hand in the treadmill while it was moving, and they got a really bad burn. So I think that's something that people don't think that much about. So thanks for talking that through with us.
Yeah, and especially if, like, mom's on the treadmill, the child wants to come do the treadmill too. Either the parent or the child don't realize how dangerous it can be.
Honestly, after my time spent with you, the two things that I got the most nervous about that I wasn't nervous about before were kids and treadmills and kids and top ramen soup.
That's funny. Well, those are probably good things to be nervous about.
Absolutely. Absolutely. Now, what about being outside? Is there anything that you think parents should be aware of, or any safety precautions, maybe with things like barbecues or fire pits? Any common burns that you think parents should be aware of?
That's quite common, and that is usually it's when they go to the beach or they go camping and there's a fire pit that had a fire in it the night before, and people don't realize there's still hot coals in there. And we've seen children walk barefoot in the fire pit and receive terrible burns to their feet, or they fall into the fire pit. And usually it's not a fire pit that's actively burning. It's a fire pit that's hot from the night before with coals. So I think that's a something that's avoidable, but you have to really be aware of it to be sure the fire pit you're going to camp at is watered down or cooled off, or your child doesn't get near it.
That's a great point, because you're right. We might not think about that if you don't see an active fire in a fire pit. I feel like it could be easy to forget that it's potentially still hot.
Yeah. I think the other thing that's outdoors that we see a lot is, especially around 4th of July, is fireworks or firecrackers, especially sparklers. That a sparkler can become as hot as a blowtorch, and people give sparklers to kids. I mean, people give sparklers to people at weddings and things, and you see a lot of kids where they either light their dress on fire or clothes on fire, or a sparkler gets stuck in their eye, and just terrible stories related to sparklers and fireworks that are, again, preventable. And people think of sparklers as being kind of innocuous.
It's true. That is one area too that maybe there's been fewer burns with children, because I know there are a lot more rules around fireworks.
Yes, that's true. Yeah, there are. I mean, they're illegal in Los Angeles, but they still have them everywhere. But I think sparklers are different, because I went to in Ventura, a wedding photographer who supplied sparklers for pictures at a wedding, and people weren't even aware of how dangerous they could be.
What about chemical burns? Are there any chemicals that you've seen kids get into that parents should be aware of to avoid burns?
Good question. I don't see many chemical burns in children. You think of acids and alkali. One thing we do see quite a bit of, which is generally undiagnosed, and which is a type of chemical burn, is what's called a phytodermatitis, where they're around citrus fruits, or usually it's lemons, and then they get out in the sun, and the combination of the lime juice on your skin and the sun creates like a second-degree burn. You get these big blisters, and then nobody knows what happened, what caused it, because it may not show up till the next day. And so you have to really kind of delve into the history to find out and figure out. It resolves, within a week, and it's like a second-degree burn, but it can be very disconcerting, considering you get these giant blisters all over you, and it looks like a burn.
That's so true. I've seen it quite a few times where the story is a patient shows up with a burn around their hands, and then you ask them questions about what they were doing in the last few days, and it turns out they're on a spring break trip in Cabo making margaritas, limes on the hands, and sure enough, they get that classic photodermatitis.
Yeah, that's right. That's a good diagnosis.
Yeah, it's a fun one because you figure out the mystery.
Yeah, exactly.
Now, what about basic treatment? Let's say a child comes in and they have a typical first-degree burn. What would you recommend parents do in terms of treating that burn?
Yeah, I think first degree is important to distinguish between second. So if you don't have blisters, you just have redness, then that's first degree, and probably can just generally treat it with like moisturizer, something like Aquaphor. You generally don't need topical antibiotics for a first degree burn because it's not going to get infected.
What about things like cortisone, aloe vera? Do you think it's fine to use but probably doesn't make a difference?
It probably doesn't make a difference. I would stay away from cortisone, just because theoretically it slows down healing. But probably for first degree burn, it doesn't matter. Aloe vera is fine. The only problem with aloe vera is it tends to, if you use just the pure, like the aloe vera plant, it dries out. So you can end up with these, it's not a moisturizer. So you can use moisturizer, you can use aloe vera if you use it with a moisturizer. But aloe vera itself is very drying.
That's a good tip. My grandma kept aloe vera plants all over her house, and she'd put it on every cut we had, every cut and scrape that we had in our skin, she would put it on. So
I think it's good. It's supposed to relieve the pain.
Yes. Okay, but that's helpful. So for first degree burns, we'll stick with moisturizer, something like Aquaphor. That's perfect. Now, what about if it does form a blister? Is that a time when they should see a doctor, or can they handle that and manage that on their own at home?
I think it depends on how extensive it is and where the location of it. In general, the first thing you want to do when your child is burned, which is probably the most common mistake is people will do all kinds of crazy things. Is that, let's say they get a burn on their hand and they get a blister. Somebody will put toothpaste on it, or mustard on it, or eggs on it, or butter on it. All those things you don't need. You just need to run cool water on it. The other thing people use, which is that's terrible, is put ice on it, thinking they're cool it, and that's the wrong thing to do, because you can get burns from ice, because it basically decreases the circulation there, and it freezes the skin, so it's killing the skin in another way.
That's a great point, because you're right. People often will jump to, at the first sign of a wound in a child, they'll jump to getting ice. So that's a great point.
So you just want cool water for like 3-5 minutes to cool the burn. And then depending on, if it's just little, if the blister's not broken, it's probably best to leave the blister alone. Let it stay intact, because there will be some healing under the blister, and also the blister protects it from infection. If it's open, if the blister's gone and you've got an open wound there, then probably antibiotic ointment on it is fine, and then a dressing. I would keep it. It's good to keep it covered. People think they want to let it dry out. That's not a good thing. It will heal better in a moist environment than it will if you let it dry out. Same for all wounds. And so you want to keep it moist, and generally just use antibiotic ointment, because it's moisturizing and kills bacteria.
So something like basic Neosporin.
Neosporin is fine, or polysporin, bacitracin, any of those.
I'm so glad you mentioned to parents that it's important to keep the blister intact, because I think so often when kids get blisters, we want to pop them. But the skin really does serve as a protective barrier. It'll keep kids from getting infected.
Yeah, it will. And you'll get some, sometimes they'll heal underneath, and then when the blister comes off, they're healed. So
is there any situation in which you would puncture and drain a blister?
Yeah, if it's, depending on the amount of pain, if it's been very painful, and of course you can get infection under the blister. So in general, if it's more than 3 or 4 days, I'd probably take the blister off. But that's just, my own opinion.
I like it. You're the experienced guy. You've seen it all. And what about Silvadene, sulfasilvadene? I know that's a common ointment to use for burns. When and in what situations do you recommend using that cream?
Interesting. I think Silvadene's okay, although it's really out of favor right now. We don't use Silvadene on outpatients at this point. And the reason is there's some studies that show that Silvadene slows down healing, but I don't think that's the big reason. The big reason is the biggest advance in the treatment of outpatient burns is the multi-day dressing. It used to be you would put Silvadene on, you would have to change it every day. The parent would have to wash it and change it, which was really difficult for them because the child's in pain and screaming. And so now there are new dressings, which I brought one here to show you. This is Mepilex. It's Mepilex AG, so it's a foam dressing that looks like this. And on the inside it's medicated with silver. So it has the antibiotic effects of silver, and it's a dressing that's like a sponge, so it can stay on there up to a week. So you can dress it, and then the parents don't have to change it every day, and you can just see them back. Usually you see them back in 4 or 5 days, or even a week, and it heals under there. It's like magic. It's great.
It's amazing. And do you notice better results than the sulfasilvadene?
Yeah, I think so. And I think it's more also convenient. The convenience, it's probably the biggest factor, is not having to change a dressing. Because first of all, everybody has a hard time putting a dressing on a child, and it's painful, and they maybe usually don't do a good job of it. And so this just sticks on there and stays on there. It's great. Can't get wet. That's the only disadvantage to it.
So it doesn't get looked at. You leave it on the burn for a week.
Yeah.
Don't change the dressing, and parents don't have to look at the burn in the meantime?
Right. That's right. Of course, that's after you've seen it and you know it's not 3rd degree, it's not infected, and so forth. I mean, I wouldn't leave it on a week if I hadn't seen the burn.
Interesting. This is great to know. I love to know that there's advancement in the treatment of burns happening.
Yeah, that's for outpatient burns. That's the biggest advancements, and there are other brands that are copying this too. There's a lot of because we use it. Also, we use it in the wound clinic. I do lots of wounds, and we do a lot of Mepilex where we can just leave it on there a week and then they come back.
And can parents buy that over the counter, or is that always through a doctor?
You know, you can buy these foam dressings. I think the silver needs a prescription, but you can get the foam dressing by itself, and then you could put your own polysporin on underneath, and then put the foam. This comes in all different sizes and stuff. Or you could even cut a piece of this and put it on. Or you can buy a different, a smaller size, and it comes with where has stickum around it, so it'll stick on the burn. And you put the polysporin on, then you put that on. You can leave that on.
And you just wrap it in like an ACE bandage, for example?
Yeah, a Curlex or an ACE bandage.
And I'm just curious, you may not know the answer to this. Do we
Yeah.
know why silver helps improve burns?
Well, it kills bacteria. Aside from that, I don't know. I mean, I have patients that take colloidal silver orally and stuff, and I don't know if it helps or not, but I don't think it's harmful. And so I think silver's traditionally been used mainly because it kills bacteria. I mean, when I was probably when your dad too, when we were pediatricians at the beginning, after a baby was born, they put silver nitrate in their eyes.
So, okay, this is really helpful to know. So, Mepilex is going to help a patient in the case not of a minor burn, but if they have blistering or signs of a second-degree burn.
Right. And you can buy the foam dressings like they have them at CVS. May not be Mepilex brand, although you can look it up on Amazon or whatever, and they have Mepilex. It's kind of a brand that's probably made by Mepilex that they sell at CVS or whatever. But it's a good dressing that you can leave on for a few days.